1890. And it says that it's not to be expected that the prejudices of ages will pass away at once, but truth will prevail in the end. And sooner or later, it will be understood that the man who teaches his fellows how to preserve their own lives is at least as honorable as he who enables them to destroy the lives of others or to gain possession of their property without compensation. So this was a time when physicians were trying to find their place in the society. As you can see, they were clearly not at the frontier of humankind. And they were trying to imagine the future for medicine. And right at this time, in England and Wales, there were about 30,000 lives being saved a year, continuously for a period of 10 years. And yet, physicians had no place or credibility that they thought they should have at that time. And if we move forward 100 years now to the current time, so this is 2015, just over 100 years later, an infant in the United States has added about 3 decades to their lifespan in a matter of 100 years. And just in the last 50 years, we have achieved about 70% reduction in cardiovascular mortality, out of which 50% of that reduction happened just in the last 20 years. So I know we talk a lot about the escalating cost of healthcare. So something horrible has happened, keeping these achievements in mind. But if we were to talk about capital and investment, just look at the Human Genome Project. If adding 3 decades to human lifespan, most of it in the last 50 years, is no achievement by itself. The US government's $3.8 billion initial investment on the Human Genome Project has yielded 180, an investment of $3.8 billion has yielded a cumulative investment, a return of about $1 trillion in the last 10 years, which is a 180-fold increase. So 21st century, without any argument, and of course I'm biased, is the century of biology. So what's on the horizon for us? The Cancer Genome Atlas, where we can match drugs to the change in the genome that drives malignant growth in tumors. The Brain Initiative, where we're trying to figure out how 86 billion neurons in the human brain talk to each other, so that we can have some insight into illnesses of the brain that we have not been able to do anything about all these years, namely autism, schizophrenia, epilepsy, traumatic brain injury, Alzheimer's, etc., etc. We are at the cusp of an AIDS-free generation. We know that the diagnosis of AIDS is now compatible with a normal lifespan. And with the advent of AIDS vaccine, this epidemic may completely be gone. So, what is our biggest problem in healthcare today? As we got better with conquering disease and illness in such a short time, another epidemic that was a unique one caught up to us. And that epidemic is a lifestyle epidemic. Now, we cannot use the conventional understandings of medicine and biology to understand how this all happened. So, just to go over this picture, you can see that in the very last 50 years I talked about where maximum progress was made in medicine. We had about 20%, roughly 16 to 20% increase in prevalence of obesity in teens aged 2 to 19, which is horrendous by any count. So what does this translate into in terms of its effect on the society? So today we have kids between the age of 2 and 19 who have, 30% of whom have abnormal cholesterol, and they may not even know it. 20 to 30% of male children have abnormal blood sugar or hypertension. These are the diseases of midlife, and they definitely have an impact on our total lifespan. And we see that in ages between 2 and 19. It's slightly lesser for female population as far as the blood sugar, fasting blood sugar, and blood pressure are concerned, but the prevalence of diabetes in girls from age 2 to 19 is 4 times higher than males. So with all this bad information pouring in, and the lifestyle epidemic that basically is out there are projections that there's a potential decline in life expectancy in the United States in the 21st century. Now, this is sort of a warning. It's a very important warning. It may not happen. This is a total statistically run model, which makes complete sense based on what we have today. But the people who argue against this say that we may have the next generation living as long as the previous one, except that they will be having lots of illnesses right from the very beginning. So how did we get there? Was there any method to this madness that we are faced with today? If you look at this picture here, you see that the consumer price index of the commodities that we consume most commonly from 1983 up until 2005. We had about a 300% increase in fresh fruit and vegetables, whereas we had only about roughly 25 to 50% increase in the prices of fats and oils, carbonated drinks. Nothing to do with epidemics as we speak of them. And what else helped? If you look at right at the time when Congress started reacting to this epidemic and wanted to put a tax on carbonated beverages, right at that very time, the lobbying expenditure of American Beverage Association rose up to 20 million from a baseline of 1 million, right in 1 year. And the result is we still don't have any taxation on carbonated drinks. Now, if we don't blame anybody for this, and we sort of look realistically at how we can tackle something like a sodium influx into our bodies that's happening every day, the salt debate, they call it. You look at the thing and you say the average American today consumes, our taste buds are used to salt intake of about 3.5 grams a day, when the recommended by WHO is 2,000, and by FDA is 2,400. And the most recent research says it should never be more than 1,500 milligrams a day. So if we ensure and execute the smartest legislation right at the center of this particular problem, I don't think that's going to work that fast. Because in terms of our taste profile, the consumers, which is us, might be able to make that cut over, say, the next 15 years is my guess. We don't have any data to go by. How quickly can we adjust to a different level of taste? It's anybody's guess. So now if we focus totally on the two biggest contributors to our lifestyle, which contributes to our morbidity over time today. One is inactivity to the left, and another one is increased body weight, or body mass index, or obesity is called. Now, if you were to separately examine them, and that's why I put them on the same page there, you see that inactivity, as marked by red, which is maximum inactivity in the bars up there, linear relationship with the human lifespan compared to obesity, which is sort of a J-shaped curve, meaning that at the exact point where it curves upward, you have a slight survival advantage from being overweight, but not from being morbidly or severely obese. Now that's a controversy that exists in healthcare and medicine today, which we don't exactly understand. But this is not to say that being overweight is helpful as such, because you can't target yourself to be overweight. You're on the spectrum when you're overweight. You don't know where you're going. So this is the latest data from National Cancer Institute, where basically both these factors, the body weight and the physical activity, are now on a single chart. And you can see the lightest bars are the ones of the most inactive lifestyles. And here you can see that in terms of the decrease in lifespan, you have the greatest decrease in the most obese category with the least inactivity, with the least amount of activity, which is 7 years. But if even with that much amount of weight, a motivated individual is able to exercise maximally, which is the darkest purple there, they still gain 2.5 years in their lifespan, which is the same as a normal weight person would do. So that means exercise really works regardless of what your weight is. And in the middle, you can see normal weight and overweight. There's a slight advantage of overweight. That means you may not need to exercise a whole lot, and even with the amount that you exercise with a normal weight, you still are not able to curb your decrease in lifespan to the same extent as an overweight person would be. So if we go to the origins of the better value of physical activity, we know this from 2500 BC. Philosophical teachings of Confucius. They knew that there are diseases that you can prevent by more activity. And these diseases were something similar like what we call as diabetes and heart disease today. Yoga that came from India was developed by priests who thought or were fascinated by the body movements of animals. And they thought it would be worthwhile to copy and simulate those movements. And this would do good to our bodies. That's how yoga was actually started. And same holds true about other societies of the past, like Athenians, Spartanians, and the Persian Empire. Now, these people didn't simply know that exercise was good. They also knew how much exercise was worthwhile. And some of the information that we got from the past about high-intensity interval physical exercise actually was proven to be correct in some of the most recent research, where high-intensity interval training improved cardiac function in people who had recently suffered from a heart attack. And this is a 2007 paper in Circulation. So, but most of the balance was in favor of moderate activity. So Sutta was one of the first physicians from India who started prescribing exercise to his patients. Hippocrates was the father of modern medicine, actually wrote the first prescription for exercise. We don't have any prescriptions for exercise in today's highly revolutionized and modern system of healthcare, which was done by Gallup. He had prescriptions which were customized to diseases like arthritis, epilepsy, TB, dropsy, and vertigo. So, if we know this works, we don't need scientific research to confirm it, because there are sections of long-living people all around the world that tell us that this is working. The Okinawans, Sardinians, the 7-day Adventists from Loma Linda, Nepalans, and Acadians. They all have many things in common, and one of them is their level of physical activity. Now, this is what we can gain from looking into the past. And one thing, if we had done before, and tried to put some sort of a structure to it, maybe we wouldn't be facing this epidemic today. So how do we work on this structure? For children, any structured activity is actually going to put them into a category of moderate or mild exercise. While if they're allowed free play, they will be able to achieve the levels of moderate and excessive exercise that they need as children. That's what children are basically supposed to do with them. So for adults, it's a little different, because none of us have time. For adults, personal motivation works for a lot of people, and they're always in the gym, or they're always doing activities much more bigger magnitude. But for the rest of us who are not motivated enough, the idea has sprung that some of this thing, if we do it and we are incentivized to do it at our workplace, or this is monitored in some way that we can log it in, then basically we can do it. We can achieve the results. And some of the latest research, the data on this is not enough because a lot of workplaces are still embracing the idea, and this is a lot of investment that has to be put in with not much gain. We don't know if it's going to be or not. So, but some of the early data from Rand Corporation actually shows that if you were to log in at your workplace or through your workplace or whatever way you choose to, this pattern basically keeps the chances of you not lapsing out of that exercise program in the third and fourth year. Those chances are much better. So, with the help of some mentors and like-minded people, we co-founded a Society of Anesthesia and Sleep Medicine, and our role is to try and figure out ways, both by ways of scientific research and clinical practice, to see how we can make surgery safer in overweight people. However, each one of us has a moral obligation to our health by way of the lifestyle we choose for ourselves. Our obligation to the society is the plan we have for all others in our lives, our children, friends, and relatives who may need help with the way they